Joining us live is Professor Robert Booy, an infectious diseases specialist from the University of Sydney and also chairman of the Immunisation Coalition. Appreciate your time. Knowing what you know now from that news conference about the Victorian situation, do you think, as Brett and Sutton said, there is a good chance authorities will get on top of this over the next 7 days, or is there every likelihood the lockdown could need to be extended again further?
Yes, they're doing a good job. To have on average about 5 cases a day, sometimes 3, sometimes 6, and for that number not to be going up over the last few days, it's really encouraging. With this highly infectious virus, Brett Sutton said you could get as many as 5 cases for every one original case, one index case, and that could occur every 3 days. So if we take a conservative approach and say there's 4, and you have that happening every 3 days, you could have 1 million within a month. It's extraordinary statistics, but because of mitigation, and simply that means all of the very many efforts that public health and the public are doing together, the rate of transmission is really very low, and they're doing very well.
I do want to ask you about that fleeting contact concept we've heard about, the sort of stranger-to-stranger transmission warnings that we heard from Brett Sutton. Some experts, Peter Collinan, who no doubt you're familiar with, the expert, he was suggesting this morning the rhetoric around that being a huge risk in terms of perhaps brushing past someone and catching COVID might be, well, he was suggesting almost a bit of fear-mongering going on. What's your assessment of just how much more infectious this strain is and whether that is a serious risk that Victorians are facing?
Well, at most, 1 in 10 cases appear to be due to this kind of casual contact. We've known about this since SARS in 2003. In Hong Kong, people in hotels were infected from people on another level. The mist, the viral infection, drifted through the ventilation system. So although ventilation normally helps and does a good job, occasionally, if floors are connected in some way, you can get transmission. So we've known about this since early in SARS-2, COVID-19 from China. Most transmission occurs in the household in close contact over considerable periods of time, hours, not seconds or minutes. Residual virus on a surface or residual circulating virus in the air over the course of 1 or 2 hours may well be important for a small percentage of people getting infection.
You mentioned China. I am keen to ask you about an emerging story from China. China's just reported the first human case of H1N1 bird flu. Is that something we need to be worried about?
I've been following the Chinese situation for 15 years. I visited there for the WHO. They have done a very good job at controlling bird flu. And bird flu can be caused by all sorts of influenza A, classically influenza A H5, but a new one came along in 2013 called influenza H7, and it caused yearly outbreaks for about 5 years. And now there's reports of occasional H9 and H10, which you just mentioned. Now, these viruses are almost always caught from men going to a live animal market and buying live chickens and getting them slaughtered and the feathers taken out and then cooking them up for their wives in China. It does not transmit easily at all between humans, so the risk of outbreaks is minimal. So the outbreaks that occurred year on year for 5 years with H7 up until 4 years ago were almost all due to wild or especially wet animal markets.